Hey everyone, welcome to Taking the Pulse, a healthcare and life sciences video podcast. I am Heather Hoops Matthews, here in the studio today with Maynard Nexon healthcare attorney Matthew Roberts. Matthew, good to be back with you.
Good to see you.
Joining us today is Jason Bernd of Novant Health. That is an integrated network of 19 hospitals and more than 700 physician clinics and urgent care centers, outpatient facilities, and imaging and pharmacy services in both North and South Carolina. Jason has been with Novant Health for 17 years and currently serves as Senior Vice President and President of the South Carolina region. Jason, thank you for joining us today.
Thank you. It's nice to meet you all and nice to have the opportunity to talk.
Well, if you don't mind, start us off by telling us about your background and experience in healthcare.
Absolutely. So I'm probably a unique individual in the sense that when I was in high school, I thought I would study engineering, get an MBA, and then one day go run a hospital. And that's what I've really had the privilege to do. Both of my parents worked in healthcare. My dad was a hospital administrator. My mom was a nurse practitioner. And so it's something that I've, from a young age, saw that it was mission driven, it was community orientated, it was a complex, exciting environment. And interestingly, my siblings also work in healthcare. And so I really grew up in a healthcare family. And I feel very blessed to have a career where ultimately the work that I do serves my neighbors in their moments of greatest needs. And so I had the opportunity to join Novant Health straight out of business school and have been there for, as you said, 17 years, growing in different roles throughout the organization and really working in developing the ability to build relationships with physicians, to help develop partnerships, as well as to help work with teams of clinicians to really care for patients in our community. So it's been an absolute privilege and pleasure, and I've really enjoyed the journey so far.
It's nice that you've stayed in the Carolinas, for the Carolinas.
Yes, absolutely.
Yes.
It is, yeah.
So we actually were in the Charlotte area for 17 years, but recently relocated our family to the Charleston area as my role changed to be responsible for South Carolina region for Novant Health. So we're excited to move down into South Carolina, and it's been an absolute pleasure living in the area so far.
Yeah, we're glad to have you down in South Carolina. Jason, Novant's got a great relationship and it's certainly a very high-profile system within the Southeast. You made a move into South Carolina when you did a collaboration partnership with Conway Medical Center. Then you acquired East Cooper Medical Center, Hilton Head Hospital, and Coastal Carolina Medical Center from Tenet earlier this year. Can you talk a little bit about why Novant made that decision to move into South Carolina?
Yes, absolutely. So interestingly, my first role in the organization was in our group called Financial Planning and Analysis, and we really looked at mergers and acquisitions and growth for the organization. So even 17 years ago, we were thinking about South Carolina as such a thriving community, as a place that we wanted to be as a health system. And honestly, we've looked for opportunities over those years to enter into the market. And I think that we really were opportunistic in pursuing the relationship with Conway Medical Center, as well as the acquisition of 3 hospitals in Charleston and Hilton Head. So really, it's been, when the opportunity presented itself, we were excited. In addition, 4 years ago, we did start to work in Wilmington with New Hanover Regional Medical Center. So I think seeing the coastal regions, understanding them a little bit better, seeing how the populations are thriving and growing, similar to the profile of other markets that we're in North Carolina. I think we saw the connection strategy along coastal South Carolina and really excited about that presence along the coast. For us now, Hilton Head, Myrtle Beach, Charleston, as well as Wilmington area. And we started with the 3 hospitals, that we acquired in Charleston and Hilton Head. But interestingly, really our desire is to have more of an ambulatory, physician-focused, less capital-intensive presence in South Carolina than you'd have as a traditional health system. And so we did think, though, that starting with kind of a land and launch strategy with 3 facilities helped really show our commitment to the community that we really did want to be here. We wanted to be a big part of this. But we will see a lot of our growth focus more on ambulatory presence, on physician partnerships, and not necessarily think about just a hospital-centric model, because we really are trying to build a network that provides high quality, high value to our communities, and really pursues that goal of, value-based care for our communities over time.
You mentioned having a presence from Wilmington all the way down to Hilton Head, which is a lot of coastline, a lot of people in that area. Can you talk a little bit more about the strategy behind this and maybe the synergies that you might see from having a wider grasp of the coastline?
Yep, absolutely. So one thing that we'd say is that we really truly believe in partnerships as a model. We're a not-for-profit health system, and we found that there are skill sets that we've developed over time that we are really good at, and then there are other places where we say we have to find partners in the community to work with. So one example would be is there are already really strong tertiary quaternary providers in South Carolina. And, we have entered into presence with more ambulatory-based, community-based hospitals. So we look forward to partnering with other health systems, to partner with established providers. We see the growth in these areas on the coast as really an opportunity to grow with those communities. And so we do see those communities having a need for more healthcare. And so our presence would be to come in and to really establish a high quality network, high focus on customer service, on the remarkable patient experience, and to have that be a complement to some of those existing services and providers that we see in the local communities. So ultimately, we hope to design our care around the needs of those communities and to really look at how do we partner with existing healthcare assets, existing other agencies that support health and wellness in those communities to ultimately serve out our mission of improving the health of our communities one person at a time.
Well, you mentioned the ambulatory strategy. Can you talk a little bit about what that may look like in South Carolina and beyond, not limited to just South Carolina, when you see more and more healthcare services provided outside of the inpatient area? And so you see more things being done, surgeries being done in outpatient. You see the development of more retail-related imaging. How do you look at those ambulatory opportunities for Novant?
Yeah, I think a great example would be that, we started working with physicians in the Asheville market in North Carolina recently, and that really was a response to a request by the physician community there around looking for partners that they could work with. And, so we started up and we had some physicians that chose to be a part of Novant Health. And I think a lot of traditional healthcare leaders might scratch their head about, well, why are you working with a physician group in an area where you don't have, any physical assets like a hospital, brick and mortar? But those relationships with those physicians helped us really get to know that Asheville community better, understand what those needs are. And, ultimately, we're now collaborating with those physicians to really look at, we applied for a certificate of need in North Carolina to build a cancer hospital. That was a service that the community felt was a strong need. The physician community felt as well. So I'd say it's a similar model that we think about in South Carolina of really identifying physician partners. And, we ultimately, I think we're not just in the physician employment business as a traditional health system would be, but we're in physician alignment business. How do we work with physicians? Some of them are interested in being a large health system. Some of them are interested in being independent. But how do we create alignment with the individuals that are providing care in our communities, and then ultimately help design healthcare resources, healthcare assets around those needs as they're identified? So we can see a model where it's not really about building a hub and spoke traditional integrated health system in these markets, but we're responding to the physician community needs, responding to those community needs to build different types of assets. And an example could be, where we could work with an oncology practice to look at providing a value-based care oncology network where we don't necessarily have to have hospital-based infusion centers, which is a traditional model that we've had in some of our hospitals in North Carolina. So just lots of exciting opportunities to try different entrepreneurial things in South Carolina and think about providing care at the right location, at the right cost, with the right level of service for our communities.
As a follow-up to that, let me ask you about you mentioned your mission, which has been evident to me watching Novant's progress over the last 2+ decades. How does your mission and your culture, your corporate culture, help you be able to develop these ambulatory partnerships, particularly with physicians? Because physicians have now been employed by hospitals for over 2 decades. with some limited success industry-wide, but the ones that seem to work the best seem to have cultures that physicians find compatible and then consistent with what they want. How do you think your culture and mission works toward these partnerships?
Right. Yeah, so I think we're aligned around a cause statement where we create a healthier future and bring remarkable patient experiences to life. And what I'd say is I think the two differentiators for our culture over the long term have always really been a health system that really truly looks at partnerships with physicians first and foremost. And then secondly, really focuses on putting the patient at the center and trying to understand what does a remarkable experience for that patient look like. And so the way that I describe physician partnerships, so if you look at our leadership model, we have physicians really as leaders, dyad leaders with administrators, really at all levels of the organization, whether that's at a practice level with a lead physician and a practice manager, or whether that's at our executive team level with our physician executives on the executive team partnering with administrators. So I think that that model has been really part of our fabric and core for a long time. In addition to having a balance of leadership of primary care as well as leadership of specialty physicians and understanding that those needs and what's happening is different. The third part about that physician partnership is to really try to provide all options to our physicians. There's not just one way to work with Novant Health. So how do we find ways to support physicians that want to stay independent but may need some practice operations support or some payer credentialing support? And so trying to create models where physicians can operate in the autonomy and in the to the best of their ability with the support of a large organization like Novant Health. The second component that I think we align around and have alignment with our communities and our physicians and providers with is around putting the patient at the center and thinking about that patient experience. And so, ultimately, the way we look at our operations, the way we resource them, the way that we really grow our leaders is trying to provide that best experience for people when they come in and they come into healthcare. We talk about healthcare as a time for patients as a time of great uncertainty. It's typically can be a pretty dramatic moment in people's lives if they have to access our hospitals, as an example. And we want to make sure that people feel that they are supported to the best of their ability, that they have confidence in the care that they're getting. So I think those two focuses over time have built a culture that I think we all align around and we feel like is an attractive model for both patients and providers, whether that's advanced practice practitioners or physicians that want to be a part of that system.
I've heard you use the word remarkable twice now since we've been talking about, and you've used it in relationship to patient care. If you wouldn't mind, spend just a couple of more minutes talking to us about how you pursue the partnerships you're talking about with that focus in mind. Like, how does that work? What would that look like in South Carolina?
Yeah, absolutely. So, we've actually done a lot of research around that word. Sometimes I'll laugh and say, the word remarkable means of note, right? It doesn't necessarily mean good. I mean, we're obviously trying to create a great experience for people. But what patients and consumers have told us is, there's components of care that are important to them. They want to have things like choice in their care. So how do you create different ways for patients to access their providers? They want to have easy access to care. So an example would be, how do our patients access their physicians via virtual care? How do they access via telephone? How do they access via their smartphones? So we have in our North Carolina facilities, we've spent a lot of time looking at, MyChart as a electronic medical record where, you can make an appointment with your provider on your phone without having to go through a phone center or a call tree. And it's just trying to find ways that make the patient feel like that they have choices in their healthcare and how they consume it and where they get it. I think the other thing is just really trying to create authentic personal relationships with patients. And a lot of that is around the culture of leadership as well as the culture of the team that we're hiring. So we have customer service training. We currently have a training that we call Spark that we are rolling out with our team to really help them understand what it is to create a fantastic experience when patients come to us. I think what it boils down to, though, is that each of us has a personal way that we authentically connect with other human beings. And so, for me, that may look different as I'm interacting with a patient. Whereas the team member next to me may have an authentic way they connect with that patient. We're trying to give our team members the space. We're trying to give our providers the space and the training so that they know how to provide those experiences for patients that set apart what they're saying. And we feel like that will be, it's a strong culture to build. It takes time to build that type of culture. You have to have the right leaders in place. And we feel like in the long run, that does, for us, create a strategic advantage as we enter into marketplaces and we establish that brand reputation where people say, I know what I'm going to get if I'm going to go access a Novant Health facility. And that's our vision, that's our hope, that's our goal for what it feels like in South Carolina as well.
So you guys have hit the ground running in South Carolina within an 18-month period. You've got an established footprint, you've got an established brand, and you've got a market that is growing. The state's going to add another 1 million people in the next decade. And we see a lot of folks moving every day, and it's easy to recruit physicians to. How do you look at the market and you see that, we've had consolidation, so there are a fewer number of independent hospitals and you've got 2 large systems, but how do you look at the market? There seems to be a lot of room for growth, but what's your take on that?
Yeah, absolutely. So, as we look at South Carolina, I think South Carolina is projected to be the fastest growing state in the nation. And so the other thing that we found, me personally, as I've really started to spend more time in South Carolina, is that these are thriving communities. There's great public-private partnerships. There's great work between the employers, between elected officials. And so South Carolina has really developed a great model for people, for companies, for employers, for folks to thrive. And so I think we feel thrilled. We feel privileged to be part of this, to be part of really figuring out how do we grow with the population in the community. And so for us, it's really trying to identify, are there places where population is growing so fast that we really need to look at adding health services. And an example would be for our facilities, we've identified a significant need for more primary care, particularly in Charleston and Hilton Head, Hardyville areas where we have facilities. So Novant Health has been committed. We've already posted 20 positions to hire more primary care doctors, because a lot of what we see is folks that are moving to South Carolina coast are maybe in that Medicare population may need to find a primary care, and sometimes that can be very challenging. So for us as a newcomer, it's a great opportunity for us to build relationships with patients, to get them to a physician that can try to keep them healthy and keep them well. And there is because of the growth, there's definitely underserved areas. So we're excited about that because it seems like such a great opportunity to add services, to build more programs, to build our access points for healthcare, and that really meets the growing needs in these communities.
Well, Jason, it's great to have you in South Carolina individually and Novant Health corporately in the state. Thank you for joining us today on The Pulse. So we hope it's the first of many times that you come and check in with Matthew and myself and the crew.
Yeah, thank you all for your time. It was nice talking with you this morning, and certainly appreciate keeping in touch and sharing as we have exciting developments that come in the future.
Thank you. Well, we wish you the best. And Matthew, on behalf of you and me and the whole crew here, we then want to thank everybody who joined us today. We hope you enjoyed learning a little bit more about Novant Health and its expansion into South Carolina. We look forward to joining you next time right here on Taking the Pulse, a healthcare and life sciences video podcast.